Good afternoon. So I'd like to start with a Rorschach test of sorts. When you look at this screen, what do you see? Do you see a glass half empty or a glass half full? I'll tell you what I see in just a moment. Today, as she said, I'm here to talk about the human papillomavirus vaccine, or HPV vaccine. It's recommended for all 11 to 12-year-olds, and it protects against different types of HPV that can cause cervical, anal, and other cancers. So why am I showing a glass of wine? Well, when it comes to HPV vaccination, it's easy to see the glass as half empty because many parents aren't getting their children vaccinated. In fact, this past year, we finally hit that 50%, literally half, of young people having been vaccinated, received at least one dose. To many of us, this is puzzling. I mean, if there were a simple step you could take to protect your child against cancer, wouldn't you? As a public health researcher, my work really focuses on understanding why more young people aren't getting vaccinated. And since it first became available, we've confronted irrational fears, anti-science sentiments, political and social controversies, and both parental and provider hesitancy. And I don't want to downplay how important all these are or the real struggles they present to protecting young people against HPV. But lately, and now we're 10 years since the vaccine first became available, I find myself reflecting on really just how far we've come. So like Eugene, I find myself being a glass half full kind of girl. And I think there's actually a lot to be excited about. I truly do think it's half full. And today I want to share with you 5 important reasons why. The first of these is that we have accumulating evidence of the vaccine's real-world effectiveness. Even with our current suboptimal levels of coverage, we're seeing benefits of vaccination at a population level, and these include over a 60% drop in the HPV infections that are targeted by the vaccine. Second, and this is something I don't think we give near enough attention to, but HPV vaccination is an important strategy for reducing health disparities. There are many HPV-related disparities, but for example, and this is just one, last week a new study came out showing a far greater racial disparity in cervical cancer mortality than we had imagined. Widespread HPV vaccination is an important primary prevention strategy for addressing this and other disparities. The third reason I think the glass is half full is that we have made several advances over the past 10 years. Advances like protecting boys. And this is especially important as oropharyngeal and anal cancers, which affect males, are on the rise. Another advance we've made, we can now protect against more types of the virus. The first HPV vaccines protect against 2 or 4 types of the virus, and we now have one that protects against 9 strains. That provides protection against an additional 10% of cancers, HPV-related cancers. The fourth reason I think the glass is half full, well, it's now easier to get fully protected at the recommended age. Because the vaccine is more effective for 11 and 12-year-olds, the CDC now recommends only 2 doses instead of 3 for this age group, and that's good for everybody. It's good for preteens because it means they will need to get fewer shots, and who wouldn't want that? It's good for parents because fewer shots translates into fewer visits to a provider and potentially lower costs, making it easier to get their child vaccinated. And it's also good for providers because it makes it easier to coordinate HPV vaccination with other recommended adolescent vaccines. I really think this change in the dosing schedule should help us boost on-time versus late vaccination. So fifth and finally, I think the glass is half full because we have learned a lot in the past 10 years about what it takes for parents to decide to vaccinate their child. And what's exciting about that is that most of these things are within our control. For example, we know that receiving a healthcare provider recommendation is the single strongest correlate of getting the vaccine. And we now know a lot about how to recommend the vaccine in a way that engenders support from parents. And I'll give you a hint here. Talk about it in the same way and at the same time as other adolescent vaccines. So we actually have a lot of momentum around this here in Minnesota. The new state cancer plan, presents some of these and other evidence-based strategies. So if there's one thing I want to leave you with, it's this. We've got this. We already have what we need to continue filling the glass. All we need to do is do it. By working together, I'm confident we can make great strides towards preventing HPV-related cancers. Thank you.